Throughout human history, few events have reshaped our civilization as profoundly as pandemics. These invisible enemies have swept across continents, leaving devastation in their wake. Pandemics have tested our resilience, exposed our vulnerabilities, and shaped our destiny. In this series, we explore 6 of the deadliest pandemics humanity has faced. Each pandemic marked by its unique origins and devastating consequences. We will delve into the microscopic world of viruses and bacteria. From the Black Death to the COVID-19 pandemic, we will unravel the science behind these outbreaks. This is also a testament to human resilience and ingenuity. Join us as we explore the history of pandemics and prepare for future challenges. The year is 1346. A deadly shadow descends upon Europe, arriving on ships laden with goods from the east. Unbeknownst to the medieval world, a microscopic enemy lurks within, Yersinia pestis, the bacterium responsible for the bubonic plague. Originating in the fleas that infested rodents, Yersinia pestis found the perfect conditions to thrive in the crowded, unsanitary cities of medieval Europe. The bacterium spread rapidly through flea bites, infecting rats and, tragically, humans. The telltale sign of infection, gruesome black boils, emerged on the victim's body, oozing pus and spreading the disease further. These buboes, filled with the deadly bacteria, gave the pandemic its chilling name, the Black Death. From its initial point of entry in the bustling port cities, the Black Death spread like wildfire, carried by fleas on rats that travelled along trade routes. Within a few short years, it had engulfed Europe, reaching as far north as Scandinavia and as far east as Russia. The Black Death's impact was devastating. Medieval medicine, ill-equipped to combat the invisible enemy, offered little respite. People died in their homes, on the streets, and in makeshift hospitals, overwhelmed by the sheer scale of the outbreak. The Black Death was indiscriminate in its victims, striking down men, women, and children alike. Entire families were wiped out, leaving behind deserted villages and towns. It is estimated that the Black Death killed a staggering 75 to 200 million people in Eurasia, wiping out between 30 and 60% of Europe's population. The sheer scale of the death toll had a profound impact on the social, economic, and even religious landscape of the time. Labor shortages crippled agriculture, trade stagnated, and the feudal system, the bedrock of medieval society, began to crumble. Religious faith was shaken as people questioned the existence of a merciful God in the face of such suffering. The Black Death's reign of terror finally began to subside in the late 1350s, likely due to a combination of factors. As the susceptible population dwindled, the disease had fewer hosts to infect. Quarantining of the sick and improved sanitation measures, albeit rudimentary, also played a role in curbing the spread. The world that emerged from the Black Death was forever changed. The pandemic's impact reverberated for centuries, influencing art, literature, and even the course of European history. The decline in the labor force led to changes in the feudal system, paving the way for new economic and social structures. The Black Death serves as a stark reminder of the devastating power of infectious diseases and the importance of public health measures. It also highlights the resilience of the human spirit as societies rebuilt and adapted in the wake of unimaginable loss. As the guns fell silent in 1918, marking the end of the First World War, a new and invisible enemy was already engulfing the globe. The Spanish flu, a deadly strain of the H1N1 influenza virus, emerged, capitalizing on a world ravaged by conflict and primed for a pandemic. The exact origins of the Spanish flu remain a mystery, but its rapid spread was fueled by the unprecedented movement of soldiers and civilians during the war. Confined to crowded trenches and troop ships, soldiers became unwitting vectors, carrying the virus to every corner of the globe. Unlike many influenza strains that primarily affect the young and elderly, The Spanish flu struck down healthy adults in their prime. This unusual mortality pattern, coupled with the virus's rapid transmission, made it a formidable foe. The Spanish flu's arrival was swift and merciless. Symptoms, including high fever, cough and muscle aches, could escalate rapidly, leading to pneumonia and, in severe cases, death. Hospitals, already overwhelmed by the war wounded, were ill-prepared for the influx of flu patients. As the virus spread, fear and panic gripped nations. Schools, theatres and businesses were shuttered in a desperate attempt to contain the outbreak. Masks became a common. The pandemic swept across the globe in 3 devastating waves. The second wave, the deadliest of the 3, struck in the fall of 1918, leaving a trail of death and despair.
By the time the Spanish flu pandemic subsided in 1920, it had infected an estimated 500 million people worldwide, 1/3 of the global population. The death toll remains uncertain, but estimates range from 50 to 100 million, making it one of the deadliest pandemics in human history.
The Spanish flu's impact extended far beyond its staggering death toll. The pandemic crippled economies, disrupted global trade, and left societies reeling from the loss of so many lives. The psychological scars of the pandemic lingered, shaping attitudes towards public health and disease for generations to come.
The Spanish flu, a stark reminder of the interconnectedness of our world and the devastating power of infectious diseases, forced humanity to confront its vulnerability to microscopic enemies. Though the pandemic eventually subsided, it left an indelible mark on the 20th century, shaping our understanding of global health crises and the importance of pandemic preparedness.
In the tapestry of human history, the emergence of HIV/AIDS marked a new and insidious threat. Unlike the bubonic plague, HIV/AIDS pursued a stealthy course. Its origins lie in the transmission of SIV from chimpanzees to humans in Central Africa. The virus targets immune cells, leaving the body vulnerable. Initially, it spread silently through bodily fluids, masked by a long asymptomatic period. Fear and uncertainty spread as the virus. Stigma and discrimination compounded the challenges of living with HIV/AIDS.
The response to the HIV/AIDS pandemic was unprecedented. Scientists worked tirelessly to understand the virus and develop diagnostic tests.
Social activists and healthcare workers bravely confronted the epidemic, challenging stigma and providing care.
In sub-Saharan Africa, entire communities were decimated, leaving a generation orphaned and economies crippled.
Communities rallied, offering support and care. Activists fought to raise awareness and secure funding.
The development of antiretroviral therapy in the mid-90s transformed HIV/AIDS into a manageable chronic condition.
Today, the global response to HIV/AIDS stands as a testament to the power of human ingenuity, resilience, and compassion. While a cure for HIV remains elusive, significant progress has been made in preventing new infections, improving the lives of those living with the virus, and reducing the stigma associated with the disease. Advances in antiretroviral therapy have been nothing short of transformative. Art is now highly effective in suppressing the virus, preventing the progression to AIDS, and reducing the risk of transmission to others. People living with HIV who have access to art can now live long, healthy lives. Despite these advances, challenges remain. Access to testing and treatment remains unequal, particularly in low and middle-income countries. Stigma and discrimination continue to pose significant barriers to prevention and care efforts. And the emergence of drug-resistant strains of the virus underscores the need for continued vigilance and investment in research and development. The fight against HIV/AIDS is far from over. Yet, as we reflect on the devastation wrought by this pandemic, we can also draw strength from the remarkable progress that has been made. The year 541 AD. The Byzantine Empire under Emperor Justinian stood at its pinnacle, yet a silent menace lurked, carried by unsuspecting rodents. From Egypt's ports, rats with fleas brought the plague of Justinian. The plague spread through Constantinople, causing panic. Hospitals overflowed, and mass graves became necessary. Emperor Justinian fell ill but recovered, showing resilience. The plague's impact on the Byzantine Empire was catastrophic. It decimated the population, disrupted the economy, and weakened defenses. The plague infiltrated every corner of the empire. Trade routes became conduits for the disease, spreading it globally.
The death toll led to severe social and economic consequences. Workshops stood silent, artisans silenced by the plague. People questioned their faith and existence amidst the plague.
The plague of Justinian raged for over 2 centuries, slowly loosening its hold with each wave. A combination of factors likely contributed to its decline. One theory suggests the plague itself may have played a role. As the bacterium mutated, it may have become less virulent. Growing immunity of the surviving population diminished its impact. The empire's resilience played a crucial role in recovery. Despite devastation, the Byzantine people rebuilt their lives and communities. Even in unimaginable suffering, humanity found a way to persevere. The 19th century marked a period of significant global interaction, but it also facilitated the spread of a deadly disease, cholera. This third cholera pandemic, originating in the Ganges River delta of India, would travel further and faster than its predecessors. The culprit was a microscopic bacterium called Vibrio cholerae. This bacterium thrived in contaminated water sources, particularly in areas with poor sanitation and hygiene practices. It spread rapidly through fecal-oral transmission, contaminating water supplies and infecting unsuspecting individuals. The disease spread like wildfire, first across India and then along trade routes to different parts of Asia, Europe, North America and Africa. Its rapid spread was aided by the increasing interconnectedness of the world, with ships and railways becoming major vectors of transmission. The symptoms of cholera were as gruesome as they were debilitating. The disease primarily attacked the digestive system, leading to severe diarrhea, vomiting, and hospitals and makeshift infirmaries were overwhelmed with the sick and dying. The pandemic had a crippling effect on communities and economies worldwide. The fear of contagion led to widespread social disruption. Despite the devastating impact of the third cholera pandemic, it led to significant advancements in epidemiology and public health. John Snow, a British physician, identified the source of a cholera outbreak in London in 1854. He traced it to a contaminated water pump, leading to improvements in sanitation and hygiene practices. This period highlighted the importance of public health. At the close of 2019, the world watched as a new virus emerged from the bustling city of Wuhan, China. This virus, initially identified as a novel coronavirus, would soon spread across the globe, plunging the world into a pandemic unlike any seen in. The virus, officially named SARS-CoV-2, caused a respiratory illness known as COVID-19. Its symptoms ranged from mild fever and cough to severe pneumonia and respiratory failure. The virus primarily spread through respiratory droplets released when an infected person coughed, sneezed, or even spoke. What made COVID-19 particularly concerning was its rapid and often silent spread. Many infected individuals were asymptomatic or experienced mild symptoms, unknowingly transmitting the virus to others. This silent spread, coupled with the virus's high transmissibility, allowed it to quickly gain a foothold in community.
Faced with the alarming spread of COVID-19, governments around the world implemented unprecedented measures to slow the transmission of the virus. Lockdowns were imposed, restricting movement and closing businesses, schools, and public gatherings. The world ground to a halt as people were confined to their homes, adjusting to a new reality of social distancing and isolation.
Masks became ubiquitous, a visible reminder of the invisible threat that had upended life as we knew it. The pandemic had a profound impact on the global economy. Supply chains were disrupted, businesses shuttered, and millions faced unemployment. The pandemic exposed the vulnerabilities of our interconnected world, highlighting the need for greater resilience and preparedness in the face of global crises. Despite the disruption and uncertainty, the pandemic also sparked a wave of innovation and collaboration.
The development of safe and effective vaccines was a critical turning point in the fight against COVID-19. Scientists leveraged decades of research to develop multiple vaccines in record time. The rollout began in late 2020, offering hope amidst the pandemic. As campaigns gained momentum, severe cases and deaths declined. The pandemic highlighted human resilience, ingenuity, and global collaboration. From the Black Death to COVID-19, pandemics have left an indelible mark on human history. These outbreaks, though devastating in their impact, have also driven advancements in medicine, public health, and our understanding of infectious diseases. As we've journeyed through the stories of these 6 deadly pandemics, we've witnessed the resilience of the human spirit, the tireless efforts of healthcare workers, and the remarkable progress made in combating these invisible threats. Thank you for watching our documentary on the deadliest pandemics in human history. We hope that by understanding the past, we can better prepare for and mitigate the impact of future outbreaks. Remember to subscribe for more informative content, and as always, stay safe and take care.